Hello, everybody. It is my absolute pleasure to welcome you to our podcast series, We Are For You, For Them. Once a month, we talk to our physician leaders and learn from them about heart conditions. 1 month, one topic. We want to thank all these physicians who make the time to give us reliable information. This month, we're going to talk about a very hot topic, and that's hormone replacement therapy, menopause, heart risks associated with it. We have Dr. Sarah Collins-Deighton, a dear friend, a phenomenal physician. Dr. Deighton is both certified OBGYN. She practices in Southeast Michigan. She's a member of NAMS, which is the North American Menopause Society. She has a huge passion for helping women navigate the multitude of changes experienced during the menopausal transition, which is critical for all of us. Dr. Deighton, what a pleasure to have you here.
Thank you, Dr. Sareen, for inviting me.
No, it's our pleasure. Dr. Deighton, please tell us, before we get into hormone replacement therapy, please tell us a little bit about menopause. What is menopause? What are the common symptoms that patients experience?
Yeah, so menopause heralds the end of the reproductive years for women. It's when the ovaries, which give off the hormones that women enjoy during the reproductive years, that estrogen and progesterone, that stops happening. And the ovaries go into sleep mode and there's nothing left. And so women lose those hormones. And that is marked by a loss of menstruation. And so when a woman goes for 12 months without menstruation around the time of natural menopause, in the United States, that's age 50. Different places around the world, it could be different, but in the United States, it's 50 is the average age. But when that happens around age 50, she can expect that she is transitioning through that change, menopause. You asked me, and some symptoms associated with it. There's the most common symptoms that people experience with loss of hormones is what we call vasomotor symptoms. So hot flashes, night sweats. She can also experience pain with sex, vaginal dryness, as the vagina is very needing estrogen to be useful in that regard. But there's also so many other symptoms, and menopause is very heterogeneous in the way that it presents. It's not the same for every woman. And some women have zero symptoms at all, but some women suffer terribly during this transition.
Thank you, Dr. Deighton. Wow, it is true. I mean, the symptom complex that women experience can be different. Their tolerance can be different. And as Dr. Deighton mentioned, different areas. So environment has some role to play as to where you are and when the menopause starts. What is the start date? For me, as a cardiologist, that's important because estrogen protects my female patients. And once menopause kicks in, then we know their risk of heart disease is almost equivalent to their male counterparts. But before we get there, would you say, what are good treatment options for all these extremely limiting symptoms?
So the hallmark of menopausal treatment is hormone replacement therapy. So replacing the estrogen and estrogen plus progesterone if she still has a uterus, but just estrogen alone if she's had a hysterectomy during the course of her life. But so it's putting back into the system the hormones that she's now missing. And that's been shown to decrease those vasomotor symptoms. Some women are not candidates for hormone replacement, history of breast cancer, prior cardiovascular disease, thromboembolic disorders. So not everybody can get estrogen, progesterone replacement, and some people just, generally don't want to. And there are some other non-hormonal things that we can do, but nothing is as effective as adding back estrogen or estrogen plus progesterone.
Thank you, Dr. Collins-Deighton. I think what I understand from that is that if you're having those symptoms, you really don't have to suffer. You can get medical attention and be treated with effective treatment therapies. But of course, there are conditions where those treatments may be contraindicated or not indicated. So it's important to get screened for them. And, there's been so much controversy about heart health and hormone replacement therapy. There were studies that told us that, if you have heart disease, the risk increases with hormone replacement. And then there are meta-analyses that came out more recently that said, hey, you know what? Maybe it's got to do when you start it. What's the age of starting it? And how quickly after menopause you started. Probably around 10 years, which kind of corresponds, or before 60 years of age for most women. So what is, in your experience, how do you navigate heart disease risk and hormone replacement therapy?
Yeah, so right now, the North American Menopause Society position statement tells us that for women who are suffering from vasomotor symptoms and who are within 10 years of their menopause or under the age of 60, that treatment with hormone replacement for those bothersome symptoms is definitely beneficial, and that we should do that. Like you said, Dr. Sareen, as women head towards 60, their cardiovascular profile shifts and changes. And so keeping somebody on hormone therapy as those vessels are changing has been shown to not be beneficial. And actually, the risks are probably greater than the benefits at that point, at this time. So the recommendation would be to wean patients off once they hit 60, because those risks really do skyrocket. Risk of acute MIs, strokes, DVTs, PEs. So, and that just has to do with the changes that occur, as you know, with the vasculature as we age. And estrogen being a prothrombotic or hormone that creates little clots that can be problematic as women hit those later stages in life. But within 10 years of menopause or under age 60, it's definitely recommended to treat for bothersome vasomotor symptoms.
Thank you. Thank you, Dr. Deighton-Collins. There's one very important topic that we all want to talk about, and that's how do we lose weight that now we are very perimenopausal? It just gets tough. Is it a medical situation, and what are your recommendations?
Dr. Sareen, I hear this every single day. Women come in and they say the same thing, that, hey, I didn't change anything about what I do. I eat the same, I exercise the same amount. And in the last year, I haven't done anything different, but I've gained 20 pounds. And what is going on? And that's maddening for us as women. And what happens is it all tends to be weight gain right around the midsection. What we have seen is that as the estrogen levels go down with the menopausal transition, there is a remodeling of the composition of the body. There's atrophy of the muscle. And we know that muscle is what stabilizes our weight. And so our body starts to atrophy our muscle, and we get deposition of visceral fat, abdominal fat. And it's that visceral abdominal fat that's, like, for you as a cardiologist, really concerning, because that's, really raises your risk for diabetes, metabolic syndrome, and those things that can, hypertension, that can be problematic for us as we go forward. So when I get this question, like, what do I do? First line things is always weight training. We want to keep that the muscle mass is super important to maintain. So cardiovascular exercise is great, but we need to kind of switch from being queens on the ellipticals to pumping some iron and maintaining that muscle mass. Eating a healthy diet that's high in protein and high in fiber, and mitigating carbs out of our diet. And then also, I do get the question, will hormone replacement help my weight? And unfortunately, studies have shown that the weight gain that occurs during menopause in people who use hormone replacement versus people who don't use hormone replacement is statistically the same. So it's not going to keep that weight off necessarily by just using hormone replacement. But what we have seen, and what is pretty interesting, is that some studies indicate that abdominal obesity, that fat, deposits there right in the midline, that's so dangerous for us, may be mitigated a little bit by hormone replacement. So if you're going to treat a woman with hormones because of bothersome vasomotor symptoms, she'll probably receive some benefit in conjunction with healthy lifestyle of keeping some of that off her midline.
That's outstanding. Oh my gosh. It's so much great information that if you have symptoms, there's hormone replacement therapy with potential cardiovascular benefits. And when started at the right time, started at the right age, of course, after making sure there are no obvious contraindications. So always look at your physicians, talk to them, but bring it up because you may be a candidate which would make you feel better. Thank you, Dr. Deighton-Collins, for making the time here today. Of course, Dr. Deighton-Collins is a close friend, is a phenomenal advocate of women's heart health, and does speak at our symposium every year as well. So we are very proud for what you do for all of us and you're doing for the society. We truly appreciate you. I'll see everybody next month. Until then, take care and be safe. Thank you, Dr. Deighton-Collins.
Thank you, Dr. Sareen.